Hiya, I'm Sam Corbett. I'm the senior PBS clinician with PBS4. So we're a small not-for-profit social enterprise working in the South. Jonathan's talking later and is probably going to talk a lot more about us as an organisation. But I'm going to talk about Rapport and the importance of knowing preference when supporting people. Anyone that's spent longer than 5 minutes with me will know that this is a particular topic of interest of mine. Joe's had many conversations with me about preference assessments. So hopefully this should build some ideas and think more about the application of rapport building from a behavioural sense. So, in terms of rapport, the Oxford English Dictionary describes it as a close and harmonious relationship in which the people or groups concerned understand each other's feelings or ideas and communicate well. In behavioural terms and in behavioural kind of settings, we talk about pairing quite a lot. We talk about pairing with the person you're working with, pairing with the teams, building that relationship and building that rapport. So this is the process where you establish yourself as a reinforcer to build up a positive relationship with the person you're working with. A reinforcer is just something that someone likes, and the primary components of pairing are to present yourself with and your words with the delivery of reinforcement and reinforce the interaction with the person without placing demands. Reinforcement is not contingent on the person doing or saying something. So we work in supported living settings in which our teams are spending time with the people we support throughout the day, and suddenly you realise that any instruction can very quickly be perceived as a demand for the person you're supporting, particularly if the rapport is not there. And it's really important to make sure we're building that rapport from the start to make sure that that relationship is set up to enable that opportunity for skill development, but also to build that relationship very quickly and enable a strong relationship. So one of my favourite ever articles written, it's one of the clearest pieces of research that talks about rapport. I recommend to go and read it and spend some time digesting it. It's Quality of Rapport as a Setting Event for Problem Behaviour. And this looks at rapport from a behavioural sense, but also looks at it from the idea of, quite often we hear that either you have rapport with someone or you don't, that person's not just a good fit, that they don't match particularly well. And whilst there are elements of shared interests and things that are really important, actually this article really looked at the idea that actually you can build rapport, you can learn and develop rapport with someone, and there are teachable behavioural skills within building rapport. So they use the descriptive assessment to identify operational definitions of good and poor rapport for team members working directly with people. They also looked at a functional analysis of the individual's participants' behaviours at challenge with respect to the interaction of two factors, quality of rapport and task demands. What they found was kind of fairly straightforward, as you would expect, that when rapport was poor, levels of behaviour at the challenge were high. When rapport was good, levels of behaviour that challenge were low. So the stronger the rapport, the lower the frequency of behaviours that challenge. And I think that's a really important element to consider. They also looked at a multi-components intervention package to improve rapport. So they thought about teaching rapport, how we can do this. And they found that when rapport improved, there was a decrease in behaviours that challenge and an increase in task completion. So the escape function of the behaviours was reduced in these elements when it was paired with someone that they had a positive rapport with. And this was a really effective piece of research that helped and shaped that understanding that actually if we build on rapport, we focus on rapport, we can reduce the value of escape as a function for certain behaviours from task demands. So why does this matter? We work in settings, we support people 24/7, we are in people's own homes, we are entering into someone's home when they don't necessarily know you. And think about it from kind of your perspective. How would you feel if someone you didn't know or like was asking you to do something you've never tried before, or something that you don't particularly enjoy. So it's bad enough when my partner asks me to do things that I don't particularly enjoy, like cleaning the house, and we have a good rapport. But actually think about if a stranger came into your house and was asking you those things. How often do we talk about new or less preferred team members being considered an antecedent within incidents? When we're looking at incident analysis, we will look at who's involved in those incidents, whether it's someone that the person is familiar with, whether they have a good rapport. As Jo said in her earlier talk, if you were there, be careful with that to make sure that it's not just the person that's writing the incident reports that's appearing that there's more incidents. And in functional behaviour assessments that identify the function as attention, we also need to consider what type of attention that is. So at the moment, when we consider functions of behaviour, we talk about the 4 functions of behaviour, but we need to think about it more specifically. We need to think about those more idiosyncratic contingencies and functions of behaviour. Is it attention from a certain person? Is someone's attention more valuable as a reinforcer? And that needs to be considered. I've just noticed in the chat that someone's put rapport equally applicable to staff as well as people we support. Yes, absolutely. We need to build rapport around teams. We need to have rapport with the teams we're working with as well. We need to build that before we start asking for lots of things. And again, it kind of links back to what Nick's just been saying, if you've been in Nick's talk, and Jo's been saying about starting small, building on that and working through. So in terms of functional behaviour assessments, when you are completing a functional behaviour assessment, you know the function of the behaviour. So quite often the function of the behaviour can be escape from less preferred team members, particularly when the less preferred or the new and unfamiliar team members are giving instructions, and access to highly preferred team members. So whenever we are looking at interventions, we need to think about the contextual fit. We need to think about the fit of the interventions we're teaching, because actually we may not be in a position where we want to put a functionally equivalent skills program in for that particular person. Actually, we might want to focus on building the rapport and relationship and pairing between the team and the person we're supporting. So sometimes we need to build relationships prior to teaching those functionally equivalent skills. It's not uncommon to see this function of behaviour, particularly for people we support who have experienced multiple placements, been in multiple settings, hospital settings, but also had a high level of turnover with teams. Some of the people we support have been in various settings, from school, hospitals, been supported by various different providers, and there has continuously been a change of people supporting, approach to support. Some of the people we are supporting don't know what to expect from who's walking through their door. And they also don't know the person that's coming through the door as well. If you put yourself in those shoes and thought about how that would feel for you, and people were then giving you instructions, even things that you do day to day, anything can be seen as a demand. Prompting someone, is it worth going to the toilet before we go out? That is an instruction. For some people, particularly if you don't have the rapport with someone, it can be perceived as a stronger instruction. So is the reinforcement that is provided by particular people about the consistency that person receives? Sorry, my taskbar is right in the middle of the sentence that I'm just trying to read. Or is it the person that they have built that rapport, is the person that actions those things? So quite often we support people who are quite reinforced by access to certain and interactions with certain people. So sometimes it might be people who are working in a management support setting, and that access is quite important. We also need to remember that they may be the people that actually respond and reinforce those behaviours. So if you've got a problem, they are the solution finders in some settings, and that is the contingency that's learned, and that's the contingencies that are being reinforced. We need to remember that and help to understand and help to build the team around to be able to provide that reinforcement much more immediately and much more locally, which will in effect build rapport. If you're continuously just the middleman to the solution, you're delaying that reinforcement, and it's not pairing yourself with the access to the contingencies, and it's something to consider. So I'm just going to give a word, contextual fit. I'm really sorry I haven't put it in the slides, but contextual fit is the first word for your CEUs. So I have worked in social care settings for many, many years now. I've worked as a support worker through to being a PBS clinician currently. Quite often we work with people who will start to support, have new teams coming in, new team members coming in to support them, and it can be really tough. We support, I've supported people in the past that, you know, they will have a core and consistent team, and it's really difficult to introduce new team members. And it can be really hard to get through those first couple of weeks to build that relationship and rapport. And quite often, unfortunately, we hear that I've heard repeatedly, I don't know whether it's the same for you, Joe, but we hear quite frequently that, you know, you just need to get through your first incident with that person, and then it will all be okay. They need to test you to make sure that you're going to stay. And, you know, I find that statement very uncomfortable, but I also need to recognise that I've heard it repeatedly throughout my career. If I'm hearing it repeatedly, we need to look into what people are understanding about this situation, and we need to have a think about what is happening in this situation for people to develop this theory of why certain situations are occurring. We can't ignore that I've heard it across multiple settings, multiple environments. I don't know whether it's the same for you, Joe. Yeah. Good. I'm not just making things up. That's always reinforcing to hear. But yeah, we need to listen to people. We need to think about what's going on for the person we support and the teams that are supporting in there. We can't expect team members to think that they just have to go through an incident for it all to be okay again. You know, we're not setting up teams in the right way if that's the perception that people are feeling. So in order to think about this, I've spent a lot of time, and it's, you know, kind of started thinking about it from the early stages, and I'd really appreciate other people's views and other people's thoughts. And actually there's not much research around those kind of initial stages of rapport building. We know about pairing and we know how it works, but kind of some of these more naturalistic situations that we observe, there's not huge amounts of information gathered around it. But we need to consider it from a behavioural understanding. So is it for that person, this is all just theories and throwing it around at the moment, but is it for this particular individual that they have experienced so many people coming in and out of their lives that actually they are just bringing a delayed contingency into the immediate? You know, if their learning history is that actually new faces don't stick around particularly long, are they bringing that delayed reinforcement into the immediate? Or is it a misunderstanding of the contingencies and a mismatch of contingencies from the team's point of view? Is it the fact that it takes time to build rapport? And actually that within that time, there may be a couple of incidents because you're still building that rapport, and actually they've mismatched it as this testing. And I don't know the answer to it. And I'd appreciate any other thoughts on it, but actually, you know, we need to start thinking and separating those things out. We need to think about the value of rapport, but we also need to support teams to understand, you know, our teams understand how important it is to have a relationship, but they also, you know, we need to help to emphasize that actually rapport takes time. Saying rapport takes time and then working in a supported living setting where we are having to build support and relationships very quickly, I understand it is somewhat of a contradiction in terms. So we need to work, how do we provide those shadowing opportunities? How do we build rapport in the most effective way for everyone? And we can think about this as people who are working in behavioural capacity to understand and build those protocols and shadowing. There is a sense of our involvement in shadowing protocols because it is a behavioural plan, you're pairing, you're shaping those responses. We need to consider it further. So I am going to jump onto preference a little bit because I can't not talk about it. but it's also really important. We need to, in order to build a rapport, you need to know what the person enjoys. You need to have shared interests. You need to build those rapport through shared interests. And we know that finding out what people we support like is a key element to person-centered planning. If you know what someone likes, then you can use that item or activity to build rapport with someone. And it helps to establish yourself as a preferred person, which increases your chance of being valued as a reinforcer, which, it all ties in together. You're building rapport continuously. It also, understanding preference is particularly key at the moment. And I don't want to say the word, I'm trying to avoid it, but we're in a situation where opportunities are extremely limited. We are spending more and more time in our house. And my experience is that, I've worked in settings, I've been a support worker, and actually being able to find activities to support someone with outside of the house is much easier than finding things to do inside the house. It's really difficult to find new things to sample inside the house and try new things. Whereas actually going out and trying a new activity is, there's much more kind of focus and emphasis on that. So preference assessments can be a really good way to build opportunities within the house. And it comes down to like kind of elements of core support, that good person-centered support elements of having an enriched environment, having lots of opportunities to engage, but then lots of opportunities for shared engagement to build those relationships and rapport. So sometimes the people with support are not able to vocally tell us what they enjoy. Sometimes things are not particularly visible in the house. I think, years and years ago, when I first started working and collecting supervision hours, I would work with the people we support, work with teams, and actually, we were working with an individual who was struggling to start their day. So the time that they were getting up and getting ready for the day was kind of getting later and later and later. And actually, we put a really effective strategy in to kind of bring that time of getting up and starting the day a little bit earlier, a very clear reinforcement protocol around that differential reinforcement for getting up versus that kind of persuading someone to get up and start their day. And that worked for a period of time, and then it stopped working. So I spent some time with the team to look at why it was stopping working. And, the reality was that this person was getting up, getting showered, getting ready for the day, but then the day was no different. There was no activities, there was no kind of focus from that point onwards. There was plenty to do in the house, but the house was very, very tidy. And everything was put away in cupboards. So it wasn't immediately available of what the options and opportunities were. And, we've all been in the situation where we've been so bored, and you've got things to occupy in your own house, but they're not immediately there. They're not being presented to you, so you don't think of them immediately. And it was the same situation. So actually for this person, we kind of introduced a intervention and a strategy that was working around the teams to offer essentially a paired stimulus preference assessment to offer choice, but then filtered it down into a single stimulus. So we started with 2 options of choice making and then filtered it down to a single stimulus if the person wasn't able to make that choice, because we're still trying to identify which level of choice making was better for this particular person. And it involved a lot of myself and the team sat completing activities all on my own, having a lovely time painting and decorating things. And, we've all been in those situations. And actually that built that engagement, that built that sampling approach of identifying preferences. We started to identify the activities that particular person was looking at and engaging with, and then eventually coming over and participating. We also started to build a bank of activities that this particular person had absolutely no interest in whatsoever. And that's important to know too. So we can use preference assessments, we can use them to build those understanding. So away from the kind of more technical elements of using them within kind of skills development programs, we can use them to just build engagement opportunities. So there are multiple ways. I will recap on preference assessments because I know it's something that, you know, for anyone that's kind of done any longitudinal studying, they are covered, but they are usually a whistle-stop tour. I think it's only me that sits there and talks about them repeatedly outside of those whistle-stop tours. So you can ask people what they enjoy doing. You can use the open-ended questions, lists, checklists, and ranking. The reinforcer inventory checklist is an incredible tool for just starting to build a bank of opportunities. I really like the reinforcer inventory checklist because it covers things that the person likes, things that the person doesn't like, and things that we don't know about yet. And that is a really important question to ask. And the reinforcer inventory checklist can be completed with the person if they're able to, or the teams around them. Please, please try and avoid doing it all in one session though, because it's really, really long. Take it in snippets, split it down. It's a really good starting point. You can then use the do not knows to start sampling those activities as well. Asking significant others, asking the people that are involved in that person's life what they enjoy, what they've enjoyed previously, what they've enjoyed now. Be mindful with that actually, you know, enjoying something 10 years ago doesn't mean it's still a preferred activity now. It's really important to recognize that. Offering a task prior to an activity. So offering it, you know, asking if the person wants to engage, use photos, use pictures, use things to recognize that matching. And some of the more formal preference assessments. So usually I do this, we were talking about this earlier, that I usually do this presentation or a version of this presentation in person where I have multiple toys out in front of me and, you know, we sample some of the preference assessments, we re-carry them out. The paired stimulus preference assessments can be really effective for building up a really comprehensive understanding of what the person prefers. We can also use multiple stimulus without replacement. They're quite quick preference assessments to look at. There are some incredible resources out there around completing preference assessments, and there's some incredible resources out for data collection forms as well that are fairly straightforward and fairly easy to use. So the expectation versus reality of preference assessments. But anyone that's kind of been taught about preference assessments in a more classroom-based setting, you kind of sit there, you practice them, you carry them out, and it's all very lovely. You can put them in an array, the right distance apart. The person that you're sat opposite practicing with, you ask them to choose one, and it's all very lovely and it all works perfectly. You've got time to take data collection, you've got your whole system set up in front of you, and it's wonderful. The reality of that is not always true. You know, you're working in naturalistic settings, you're working in someone's home, you're supporting to understand preference in an environment which is probably loaded with lots of fun things to do. You're making, you know, all of those things are in front of you. That choice making, you know, we don't even know, sometimes we don't know at that point what the level of choice making for that person is. And you need to consider flexibility in your approach. That's the second CE word, flexibility. So when you are looking at some of the more formal preference assessments, some of the considerations, think about the environment that you're completing the preference assessment in. Think about what other distractors are available. Think about, you know, where you're doing it. Is it an environment that the person's comfortable in? Because that's the most important thing. And then think about whether you can carry out the preference assessment in those settings. Think about who will be carrying out the preference assessment. If someone was trying to find out what I liked, I'd much rather it was someone I knew trying to find that out than, you know, this person who's just turned up with a load of things that I've never seen before, trying to find out whether I like them or not. You know, you will have some, you know, potentially have some observer reactivity from that. You might have the person picking things to get you to go away, or you might have the person not knowing what to choose because they don't know which, you know, they're not familiar with them. You're not presenting them in the way that the person can understand what those options are. Use the people that know the person well. Work with those rapport within preference. Think about the time. Are you looking at a quick snippet, or you know, is this something we're going to be carrying out over multiple days and multiple opportunities? And think about what the purpose of the preference assessment is. If it is to find out what the person enjoys, you can do it so much more naturalistically. If it's for a more structured skills teaching protocol, you might need to look at things that are a little bit more structured in terms of your assessment. Think about the purpose. With any strategy, any assessment, any intervention we are putting in, we always need to know the purpose of what we're doing. And that's really key.
15 minutes.
Thank you. So some of the more naturalistic ways, just trying new things, have a go, but also remember that, you know, that might just be, like I said, sitting in a room, the other side of the room, you doing the activity and just recording whether the person is even looking over at you, watching what you're doing. And remember that takes time, and really tighten up your recording so that you are taking that data as well. Did the person engage with the activity? Sometimes isn't enough. Did the person show any interest in the activity? Did the person approach? How long did they engage for? All of those things are key for understanding whether someone is building a repertoire of preferences. Single stimulus. So some of the work that our team have been doing recently is looking at assessing preference on a kind of more daily basis. One of our team of clinicians has worked with the team that's supporting someone to look at offering essentially a paired choice, but on a daily basis. It's very prescribed for the team, so it's all set up in the background, but it's very prescribed for the team, so it's really easy for them to carry out, but it's building a real understanding of activities that person is enjoying in the house. And this is someone who's previously had quite a small opportunity of activities that they enjoy in their house as well, so it's really helping to build and shape those things. And spending time sitting and finding out what the person enjoys in a low demand environment. You are finding out preferences, you are building rapport, it all ties in nicely together. It's such a key element and it's quite often missed. I also sound like a salesperson for preference assessments, I'm very aware of that. So working with teams to assess preference. As I said earlier, the person who has the rapport with the person you're supporting and working with is a key person in this. If you can build and get them to understand preference and develop preference assessments, you have got so many benefits. There's more opportunities, the rapport is already there, there's engagement opportunities, developing skills of teams. A preference assessment should be something fun to do in the first place, so it's actually a rapport building situation anyway. So think about the terminology. Do you need to call it a preference assessment? Joe talks a lot about terminology and how we get so stuck up in our own dictionaries of language, and actually doesn't need to be called a preference assessment, or are we just finding out what the person likes? How can you simplify recording? When you are thinking about which preference assessment to use, think about the contextual fit of the preference assessment for that person, but also for the team. What works with the team to carry out as well as the person we're supporting? And plan it, make it as prescriptive as possible with a balance of flexibility in approach. Support the team to understand that, you know, it might not always look perfect, it might not always go to plan, but that's fine, we're still learning and we're still developing understanding. And I'm just going to end with person-centered planning and preference. I think this is another incredible article. So we talk about person-centered planning a lot. We talk about using a lot of the person-centered tools. We use a lot of the Helen Sanderson tools, which are incredible tools to help to understand in person-centered planning. But this article reviewed preference assessments and looked at the information gathered from person-centered planning tools and whether it mapped alongside the information gathered from formal preference assessments. actually they found that the items didn't match up as much as they thought. So this is a very brief summary because I'm aware of time. They didn't match up as much as we thought. So what this article kind of highlights is that actually we should ask the person, we should involve, we should use person-centered planning tools as those interview tools, but we should also be combining them with those more direct assessments, observations, interactions to inform our information for the person we support to build a true understanding of preferences. You can also use them for building team preferences as well. So if you want to build reinforcement preferred items, you can use preference assessments in a naturalistic way to help to understand teams that you're working with as well. Things like preferred snacks for team meetings, that's a really key element that can make a team meeting much more reinforcing to everyone. So that is a whistle-stop tour of rapport and preference assessments. There are lots of references on the sides which will be available, but I will stop sharing, and if there's any questions, Joe?